good afternoon, everyone.
Good afternoon.
And
no masks outdoors. So.
Yes.
No masks outdoors. We were outdoors.
Yeah.
مبروك علينا. No masks outdoors. It's a beautiful March.
Yes. Good afternoon, everyone. Dr. Yasmin and I are here with an interesting topic that we would like to talk about. And get your feedback, your questions, and know more about
questions.
whatever you want to say.
نورين.
دكتور محمد بنورك. Thank you so much.
دكتور الأخبار. يسعد مساكم جميعا. تسلمي رنوشة. تسلمي. Okay, so we're going to talk about white crowns in children's teeth.
Right.
بس أول حاجة they have to ask us questions, صح؟ واللي هيسألنا بالعربي هنجاوب بالعربي.
واللي هيسألنا بالإنجلش we're going to answer in English.
صح؟
And yes. Hello.
Hi doctors. Hi سلمى.
Hi.
دكتور مصطفى خلي بالك عشان هنا كده you're like cut. أصل إحنا we have
two phones.
كده يعني. Okay. طيب so we love their questions and we want to know what do they think about white crowns in children.
So I want to know about what you guys think, and we'll also tell you more information about white crowns.
Yes.
So,
and we can talk about Bhav. The latest, the latest reel that we both posted. Yeah, I like it. You can go ahead.
Right. So to start talking more about white crowns in general, they haven't been on the market for too long, and sort of the aesthetic demand. Made the market go, and sort of have a white aesthetic alternative to the old stainless steel crowns that we used to restore children's teeth with. So the stainless steel crowns are awesome. They're great. They protect the teeth. They do the job and everything. It's just that the color is not always satisfying to all parents and to kids as well. So white crowns are the options. If you want, that's the difference between a full-on back teeth made by SS crowns and full-on back teeth made by white crowns.
It's very interesting that lots of parents do not want this anymore. They just want this.
The market or the thoughts of the parents and the demands are changing, and they're becoming more towards I'd rather not have my child having a silver tooth and all of that. So white crowns are the excellent option here.
The thing that lots of kids as well choose it. Okay, so what are we going to talk about? First, are we talking to dentists or parents? What do you want to talk about? Are you a dentist watching us? You can ask us your questions. Or you're a parent that want to know, for example, the difference. When do you use this one? When do you use that one?
How do you do this? How do you do that?
What are your questions? Give them to me. And by the time they think of their questions, when was the first white crown you put?
When was the first white crown?
Because you're very good at white crowns. Not a lot of dentists are, which is amazing.
Thank you.
I'm so lucky to have you.
So the first white crown that I've done was in 2015.
2015?
And that was my first order of white crowns.
Good job. Good job.
I did that in my undergrad.
And it was sprig.
It was easy to do the old name for sprig.
It's probably the first white crown I posted as well.
You posted as well,
طيب دلوقتي by the time dentist, we have a dentist, other dentist, and dentists are gonna ask us questions. صح؟ ريام
الدلين
and Selma. Don't forget to ask us your questions about white zirconia crowns in kids. But let's talk about Bhav. لأنه he's 4, صح? He's 4.
4 years old.
And she's a dentist, Dr. Zain. I remember you.
Hi, Dr. Zain.
Hey, Dr. Zain. So he's 4.
4 years old.
He's worked on his teeth. It's not like they didn't do anything. They did. And what happened were the fillings were haram.
First of all, he had fillings done all over, which were really, really bad.
How long ago were the fillings done?
3 months.
4 months.
First of all, the child was traumatized having worked on the chair. He was already, fed up of all the dentist-related things.
And he has 2 sinuses. One sinus, one swelling.
Swelling as well. He was not happy about the condition of the teeth. And if you remember, the mother was telling us that every time he smiles, he just puts his hand like that. He's so embarrassed from
Actually, I'm on my way to be a pediodontist. Any
suggestions?
Yes, of course. Do white crowns, not just silver crowns. You need to do them.
Yeah.
It's very nice. So
if your program has white crowns, make use of that. If your program doesn't, you can actually buy your own and start practicing.
And attend courses.
Yes.
I don't know who gives courses together. You can attend courses. We love to have you.
Yeah.
Yeah, because you need to acquire it. However you have
it's something very, very important nowadays. My question is, zirconia crowns has the same longevity as stainless steel crowns? That's a very, very, very nice question.
Yeah.
So I would reply to you from a systematic review that I did about the comparison of full covered crowns. The longevity of the zirconia crowns and the stainless steel crowns have shown similar results.
Absolutely.
Okay.
They're the best.
And
they're very strong.
And they're very strong.
They last.
So in terms of longevity, they showed similar results. In terms of plaque adhesion, zirconia crowns was better than stainless steel crown. Because it's
There's no plaque
at all.
You can see all the pictures and follow up. The teeth have plaque. The
zirconia crowns they don't have plaque.
It's so cute.
Yeah. And in terms of gum health as well, zirconia crowns was better.
Much better than the stainless steel crown. Stainless steel picks up plaque, picks up food, picks up stuff.
Yes. So I hope I answered the question.
Yes, I hope. And we love your question. Yeah, don't forget to ask us Dr. Zain. Actually, she attended the last course in ADEC. So please tell me if you already for I think that's her.
Yeah.
But don't forget to send me if you've used them or not.
That's
she
great.
says great.
Okay.
Yeah.
Thumbs up for you.
Yay! Okay, so let's continue about Bhav. So we said swelling, sinus, he was fed up. I can't believe that a 4-year-old would smile and be like,
yeah, he was so self-aware. Bhav was so self-aware. Okay, and when we were doing the discussion of the case, and remember when we wrote up the topic that we're gonna have to remove the 4 front teeth,
right? And they were very bad. You can see them in the picture.
The mother was
devastated.
Yes, I'm the one from the great demo.
Yes, I know. Yeah, thank you. It was a great demo. It's okay.
Yeah. The mother was very, very, very sad that we might unfortunately need to take the front teeth out. And so we directly started thinking and looking into alternatives and how and where and how is the feasibility of us, giving that child a smile back. And if you look at Bhav's teeth, they were really, really damaged. And even if you look at the lower teeth were pulpily involved.
Now I remember. They're all crowns.
The lower teeth.
They're all crowns.
There isn't a single tooth in Bhav's.
And they healed so
beautifully.
So happy.
There isn't a single tooth in Bhav's mouth that is not crowns. All the teeth. Yeah, all the teeth are crowned. The back teeth are silver
really
crown. The canines are white crowns, and the upper canines are white crowns. And guess what?
What?
Guess what? You want to tell them about that?
No. I want to keep it our secret. It's our secret. But how long did we take in this GA? We intended it to be 2.5 hours. So 3 actors.
Yeah.
لأنه actually we restored 20 teeth and how many zirconias?
How many zirconia? 6, 7, 8.
8 zirconias.
Actually, I'll count them.
Yeah, no. Don't tell them our secret.
Okay.
But look, we have dentists there. Okay. So check the picture out and tell us how many zirconia crowns replaced.
Yeah, you know what? Yeah. How about we put a question on our stories
and see how many
zirconia crowns replaced by this child.
So we ask you,
I'm
watching you.
Yeah, we're not revealing any number here.
No number reveal. But it was amazing. Because the smile on his face after his smile got big.
His confidence.
Yeah. Nice idea.
Nice idea. We'll be waiting for your answer.
Yeah, tell us. And Dr. Sajjad, we have a pop quiz that is check the latest
reel that we both posted.
We wanted to both share it, but we couldn't.
We apparently the collaboration on Instagram can be 3.
Us in the clinic. So the clinic had to post once with me, once with him, because we both worked on it. So Dr. Sajjad, the question is yours. Ask him the question.
Yeah, Dr. Sajjad will be more than happy if you answer this question. The last reel of the last patient that we posted. How many white crowns did that patient get?
And Tino Paulino we know who you are. Check the last post and tell us how many white crowns we placed. I know, Tina Christina, my Tina Christina,
okay.
my baby Tina.
Then let's wait for her.
Okay, so we said we're gonna quiz the.
Yes.
We're
going to post the question.
So what else we wanted to talk about, because it's so important for us to create awareness.
Yeah.
Still, a lot of parents up to this day and age, it's just a baby tooth. Pull it out. Just a baby tooth. Pull it out. Why do you have to? Why are you doing so much treatment?
Treatments.
Like, what is this?
First of all, if you
Why
don't
don't
end up
people
doing
care?
any treatments, kids.
We love you, doctors. We love you more. We love you. I love you. I love you. I love you.
Thank you so much.
Shy.
So if you don't do treatments, kids will end up coming back with pain,
Absolutely.
abscesses, infections.
Such as a 12.
12.
What? We won't do the reveal, or we do?
No, we won. No,
So
we
Jad,
won.
we
I
won't
want
tell
his
you.
answer on the question. not
Yeah. Okay, we're milking it. But
Right?
easy. Thank you, Dr. Sajjad.
Jad, you're the
part of
best.
our life. He always,
Yeah, let's wait
Hey
back
there,
then.
Shah.
Uh,
Hey there, Shah. Okay, so.
So, they'll come back with pain, they'll come back with abscesses,
I
they'll
don't
come back with
know.
infections,
Why
and
don't people care?
and they'll come
Breaks
back
my
with
heart.
us ending up removing teeth instead of restoring them.
And imagine a baby,
Yeah,
they're happy with their smile.
Two
and
of
then
Bhav's teeth had to be removed.
4. Right.
Two of the back ones,
Yeah,
Two of the back ones
yeah.
had to be removed, and 4 front ones as well.
Yeah. So 6. Now they're gonna know. Sure, Hazza. You gave away our answer.
I only gave away a hidden hint, but then you revealed the hint now.
No, I didn't. No,
Right.
not me.
Yeah.
Okay. So. What else do you think?
What else do I
about
think?
this? That when the child. Did I ever tell you about this boy? His name is Omar, and they were calling him Abu Dirisha, like the one with the window. They'd be like, his family, his mom and dad. They're like, they don't call him, hey Omar, come. They're like, Abu Dirisha, come.
Abu Dirisha. Dirisha is like in window, so which
Because
means
he has
that
no front teeth.
no front teeth. So
Abu Dirisha. So poor
yeah.
baby. I loved him though.
Yeah.
He's so
Did
cute.
you fix the Dirisha though?
You know what? He wasn't too bad.
He wasn't. Yeah.
He got a thick skin, but of course not all our kids are the same.
Bob was very.
He was
self-aware.
sensitive.
He was
You
very
know?
self-aware of.
Nadine, I wish not. So it is important to give the kid what they want. Unless they're not bothered by it, that's great. But some kids are, any little word is said to them hurts them. I had another child. She had one tooth that's lost because of trauma a long time ago, and she keeps looking and be like, "Why do I have a missing tooth?"
Yeah.
She keeps asking.
When will my tooth come
Come
back?
out,
Yeah.
exactly.
When will my tooth come
and
out?
she's quite young. She doesn't even remember anything, but all she knows, she has a missing tooth, and she keeps asking, "Why am I not like the others?" It's so human to always want to do this.
Yeah, 100%. Okay. Back on the frame, right?
Okay. So, what else do you think?
What else do I think we want to
We were
discuss?
discussing about Bhav. It's so nice. For the self-esteem, for the confidence, for the happiness, for the chewing, for the eating, for the trusting food.
For the smile.
I have one more, but it's not about white crowns. Can I say?
What is it?
Okay, so this is last Thursday, so it's just like a few days ago, and he would eat and then be like, I forgot eating hurts me, and he's a special needs kid.
Oh.
So you could see. So the mom says he forgets, and then he eats, and then it's like, and then he just throws the chicken around. So he has chicken, and he just throws it because it hurts him. And then he goes for like pasta, potato, anything that doesn't hurt him.
Very soft and doesn't hurt his teeth.
And doesn't and she just like eating it and just throwing the food makes me sad.
Yeah.
Doesn't make people
The
sad.
child needs to experience that because of his teeth. That makes me sad. That's why,
Okay, what else? We want to say something happy now about white crowns.
White crown.
Okay, when is the best moment that you had giving a child a white crown?
The best moment?
Yeah.
I think it would definitely be Bhav.
Then definitely be Bhav.
Yeah.
I
Especially on
love
the
Bhav and
follow-ups.
his reaction.
Especially
He's
on the
amazing.
follow-ups.
He was so happy.
And when he's like,
He loves us.
he's like,
He loves coming here now. Did you see how
Yeah, and we can actually brush his teeth here in the
Yeah,
clinic.
he doesn't mind
He doesn't mind us.
And he doesn't mind the high fives.
He doesn't mind anything. We use a paste and a brush, and we cleaned his teeth the other day. He was more than happy.
Yeah,
he was more than happy.
I have another girl. She's so cute. She's one of those girls that, are you gonna cry today? She's like, yeah. So she sits on the chair. So she had terrible front teeth, and she sits on the chair, and I'm like, are you gonna cry? And she's like, yeah. I'll just cry. I don't care. Again, and then I finish the white crowns, and then I'm like, take the mirror. She's like, then take the mirror. And then she's like, hey, wait a second. What am I doing? I'm sleeping with the enemy. Okay, I'm gonna cry now. But she looks. She's so cute. She had conflicted reactions.
Who was the enemy?
Yeah. Because she always comes, tells me that she's gonna take 1 or 2 gifts and she's gonna cry. No matter what I do. And it's okay, I let her. And then after we were done, we're having gifts.
Some kids are just,
and she
just don't like the environment.
And she insists on taking pictures.
Pictures as well.
She insists on taking pictures. She doesn't go. And she insists on taking gifts. Yeah. She doesn't go. Yeah. And she sometimes insists on doing videos. She doesn't leave. Khalas, she knows. She did the treatment.
But during the treatment, she cries.
She doesn't cry.
Kids are so cute.
Yeah, she just, it's a negotiation.
Yeah.
So how much time are you going to cry? And she's like, 5 minutes. No, she's like, I'm just going to cry. She's like, I'm just going to do it. Why are you asking me? And she's so cute. But I had an amazing reaction from her after smiling with all her fixed teeth. She's amazing. And she's a girl.
Okay, if I'm going to ask you the same question, when was the moment you felt, you were very happy after using white crowns? That's one specific moment.
Yeah, that child would be it. Okay, let me remind you of the first moment that I put one of those crowns. Again, the child didn't see it coming. She had terrible teeth, and when she smiled, again, she's a girl, and I remember she's amazing. And her mom, she almost cried. Wow. So I've had a few patients that were so over the moon, and I don't forget them. One of the moms that I put a crown for, first I showed her the silver crown, she cried. Yeah. She cried. And I'm like, what did I do wrong? I'm sorry. Yeah. And then when I put a white crown, and she can see all white crowns at the back, these are back molars, not front teeth. She was so happy, and I was happy she's happy.
Yeah.
So this happiness is what makes us.
I would say, if you remember Christian.
Yes, I remember.
Christian is also one of
Yes, he is your happy. Yes, I'm so happy.
Yeah. 1 year, 10 months old child.
He's such a cute. I wouldn't forget him. He's
right?
So cute. Yeah. I love your patience.
Yeah.
So, and his mommy was super duper happy. So, and I changed his smile.
Yeah.
He doesn't know anything.
Do you remember where they came from? They came all the way.
Yes.
Guess what? Where did they come from?
All the love from Lebanon, Dr. Yasmin. Oh, Salma, you're from Lebanon. We love you, Salma. All the love for you from Dubai. We're talking about white crowns. We love your questions. Don't forget to keep them coming. And guess, where do you think that patient came from? Yeah, alhamdulillah. We have a lot of patients travel from as far wide, everywhere to be able
to get treatments here.
Yes, to get treatment here because, even yesterday or the day before yesterday. Someone's famous. Someone's famous. Yeah. Good.
That patient actually traveled and came all the way from the United Kingdom to get his teeth treated.
UK, exactly, and so beautiful.
So the other alternative was that they've given them in the UK that they're gonna end up removing the 4 front teeth.
Even yesterday I got a patient from the UK, just removed.
So the parents were like, no, I'm not removing 4 front teeth for my 1 year, 10 months old child.
Yes.
Okay. And they came here, we fixed the 4 front teeth.
Yes, and mashallah, he looks beautiful. I can't wait to see him for his follow. Let's call him.
I saw him for a follow.
When?
A month back.
No. Cheating on me without showing me your followers.
I saw him for a follow. A month back. They came back again.
And now he walks.
He jumped, and he's this big now.
He's so cute, he's this big.
Now he's this big.
And haram, he had broken down teeth. So
Yeah.
I'm sure it was
And now,
affecting him.
and now he has his E's after.
Nice. And they have the care now.
No, they don't.
Good.
Thankfully.
Perfect.
The mother is brushing.
Mashallah. Good. And that's the great. Even
Guess what? He remembered me. He remembered
He's a
me.
baby.
He
And
remembered me.
kids like Bhav and even older kids like Christian, who's a younger kid, they remember, and their moms, because they're brushing, khalas, they keep the standard. So that's what I love. I mean, the last thing we want is to do all this incredible work, and when it comes back. It's broken.
Yeah. So I'm glad. No, everything was actually perfect.
Yeah, and I always educate parents not to be super happy with composites that are gonna break down in 6 months. That is not what we want to do.
Exactly, 100%.
We want to give the child a long-lasting solution that that makes the teeth fall by themselves, and they're still super healthy and super happy, and the child is super healthy and super happy. Yeah. Oh, gotta go, friends. At work. See you soon.
See you, Dr.
We'll
Sujat.
tell you